All right. So, Dr. Williams, I got to get back to you now. So, what did you end up doing for Alex surgically?
So what we did was one operation, multiple procedures. We diagnosed a compression of the proximal tibial nerve. Well, let me start this way. The first biggest complaint was the top of his foot. So we diagnosed him with the compression of the common peroneal nerve of the fibular head. He did have some downstream findings there that we thought the superficial peroneal nerve also may or may not be affected. But again, when I get to the end of this, I'll tell you why we decided to do what we did. He could not move his toes in flexion, so we examined him and found a proximal tibial nerve compression that we felt was at the soleal sling. But he had an EMG finding that said he had tarsal tunnel syndrome. He had a wicked Tunnel sign in his tibial nerve of the tarsal tunnel. In addition to that, remember we had the inner calf, which responded to lidocaine block temporarily, giving him relief of pain, an area that seemed to be consistent with the saphenous nerve. And then there was a branch on the lateral calf which most people who have a common peroneal nerve don't complain about. What is his number one problem? Like, he can't move his foot. Like, he wasn't walking, and he couldn't wiggle his toes, and he couldn't raise his toe very well, his ankle up. So we know we wanted to do the common peroneal nerve, and we know we want to do the proximal tibial nerve. Those are the two main operations. And then we have an EMG and an exam that is totally consistent with tarsal tunnel. So we want to do the upstream proximal tibial nerve, and then of course we should do the tarsal tunnel as well.